There. That's the one I want.
So I've told Stacy, I've found that recording these is so beneficial for me. I'm not a great note taker, and it drives me crazy to be looking down at my writing notes instead of looking at the screen. So the benefit of recording really helps us to create accurate meeting minutes. So thank you. But I'm Jason Coleman. I'm with the American Cancer Society. I'm not with the University of Rochester or Wilmot, but this group that we've pulled together was born out of the CCAC committee, which is based out of the Wilmot Cancer Center. And the CCAC, that acronym stands for the Community Cancer Action Committee. So the focus is really on cancer and cancer prevention. But that, as exampled by this group, it takes many shapes and forms. It's not always black and white. Prevention is a very 30,000-foot view. So, a lot of the activities that we do align with that mission. So the CCAC has been up and running for a couple of years now. There's a couple of different work groups associated with that. Our work group that I co-chair with a woman by the name of Michelle Foster, who's with Pivotal Health, focuses on access to care. How do we get more folks within our catchment area of the Wilmot? It's a 27-county catchment area. It's a huge footprint. Connected to care, because what we see is that, number one, rural communities, especially, as Julia just pointed out, Wi-Fi can be spotty. The drive to get to a provider can be arduous and lengthy. So we see great potential, and the evidence supports this initiative that using libraries as telehealth hubs with HIPAA compliance will avail more access to patients to interact with providers. Obviously, it's not going to be serving as an acute location with a broken arm or bronchitis, but for a patient to re-engage and engage in healthcare, because that is really the golden ticket, the Willy Wonka golden ticket, is to find patients that have either been disenfranchised with healthcare, who have participated in the past but haven't seen a doctor in a long time, or those that are just occupied with other things, right? And, not willing to make that drive and don't see the value and the benefit to prevention and working with primary care providers. Good morning, Kim. Welcome.
Thank you. We're short-staffed today, so I'm only the one here, so I may have to get up along
There's a lot of that going around. No need to apologize. But we see great potential, and especially in rural communities, rural and metro. If there's a transportation barrier, and specific to cancer care, really, there's appointments that don't need a patient to drive all the way into their oncologist or their interventionalist for an appointment. And the same holds true for primary care. To engage in a prevention call with a provider or telehealth call. And we use the example that we're kind of zeroing in on is the opportunity with lung cancer and lung cancer screening, right? The vast majority of the population, especially in rural areas, number one, aren't aware that lung cancer screening is a thing. Number two, smoke at much higher rates than a lot of the rest of the population in other counties. So, and three, from a policy perspective, it's not a one and done. I can't call Kelly today and say, Kelly, you meet the criteria for lung cancer screening, let's get you in, because it sometimes takes some time, and it takes a couple of visits to move a patient from an area of passive interest in screening to an area of actually taking action and following through on that appointment. It takes some patient navigation, and that is an ideal sweet spot to interact with a patient navigator from their provider's office to say, well, let's talk about your smoking history. Let's talk about your risk. Let's explore some of the structural barriers that may exist that we can help you with to get you screened. It's not a simple process because there's a prior authorization that needs to take place, but that's just one example. We've talked about the benefit of mental health interactions with providers at some locations. But the libraries of the days past, I'm telling you, I'm 53 years old and I have PTSD from that card catalog when I was growing up at the library. The library, that's the library of the past. The library of today serves more of a community focal point that can be a health hub, that can be a link to social services, that can be a link to literacy programs within their community. It's really like, there's a real place for this type of interaction or type of utilization of healthcare within rural communities. So, I'm rambling a little bit, but that's kind of where we came about. Stacy has been leading the charge from the Maston Public Library and an integral part of our Access to Care work group. But we do have some evidence that I'll circulate in an email following our call today around a current grant project underway at URMC that's looking at increased telehealth use, and also some other publications on telehealth use specifically to libraries that may benefit our work. And I think I'll give each one of you an opportunity again to introduce yourself and tell a little bit about the resources available at your particular location, the current utilization, and then your visions for future state as to what you'd like to see and how we may get there, because I think that's really going to be the benefit of this group specifically. This is, I use the quotes, think tank, right? There's no format. We don't have a blueprint and an agenda for what you guys need to do or can do, but we do have some evidence. But I think the meat on the bone is going to be the best practices where you say, here's the population that we serve in our community. Here's the barriers that they face. Here's my ideas on what I think may work in order to increase utilization, because you all, and Kelly, you and I have interacted on this numerous times when I've stopped into the library, that, you've got these resources, but they're so underutilized. And, we need to think about marketing, how we can market to our patrons, our library patrons, and what resources we can create or what already exist, and get them in the hands of each and every one of you at your locations, while at the same time, we need to work with providers in the area to say, hey, Kim, I need to see you, quote unquote, for an appointment. A telehealth appointment would be a perfect option for this particular type of visit. Is that something that in fact, you can go to your local library at Friendship Library and use their HIPAA compliant telehealth booth that's got a great Wi-Fi connections for you and I to interact and have that appointment. It's 10, 15 minute. I don't necessarily need to physically see you. Would that be more convenient? Let's get that scheduled. Those types of conversations. Currently, providers don't do that. I mean, I can say pretty much across the board, most don't do that. In fact, I've piloted this with appointments with my providers and my specialty providers. And the last one that I inquired about, without giving you my life story, I do see an oncologist for follow-up for a cancer that I had a couple of years ago. So I had an appointment with her a few weeks back, and I said, what's your thoughts on telehealth? How often do you use it with your patients? And she made this face where she went, you really think that's as good as a regular appointment? So right there, I knew, number one, she doesn't suggest it. Number two, she doesn't believe in the efficacy of a telehealth appointment. So she's clearly not suggesting it to patients. So, that there, in my opinion, presents an opportunity, right? We can work with providers to say, how do you structure these appointments? Is it just a last resort appointment? Or is it something that we can build a workflow around, just like you do if Kelly or Jason or Julia or Kathy or Stacy are coming into the office? You've got a workflow. You look at a pre-visit plan. You say, we've got 1, 2, 3 things that we need to cover at today's appointment. Okay, number one, we're going to need a referral for XYZ. Do we have that ready to go? oh, we're going to need a prior auth for this. Do we have that paperwork ready to go? Or do we have electronic signatures available for our patients using telehealth? Maybe that's an area of improvement. These are all types of levers that we have to pull and push in order to increase the efficacy of a telehealth appointment, which will then have providers more willing to say, sure, let's do telehealth. And then they'll have their patient flow for the day, which will list Jason at 9, Kathy at 9:30. She's telehealth. Kim at 10, and we'll be able to build that workflow, and they'll all look the same. They'll all be comparable. So that's future state. That's like in a perfect world, utopian vision of how this can move forward, which will ultimately result in a healthier rural community that is involved with healthcare. The gateway to everything within healthcare is that first primary care touch point. If you're not doing that, the likelihood that you're ever going to connect to prevention is very slim. The more likely scenario is that you as a patient are going to have something acute, and you're going to show up at the emergency room, and they're going to say, you have this condition, be it cancer, be it, complications for diabetes that wasn't intervened, a stroke due to high blood pressure, because you didn't have a relationship with a primary care provider and see that primary care provider at a minimum of once a year, really. But to have that touch point to say, yeah, I felt a little faint yesterday or the day before. Well, let's get an A1C check on you. Let's check your sugars. Oh, you've got type 2 diabetes. Let me call in a prescription for you at Walgreens, which is only a mile or two from your home, or a Kinney's, or whichever, and have you fill that script. Now we've got a situation where a patient's primary care chronic condition has control and decreases the likelihood that they're going to suffer end stage consequences of that primary care. So I have a tendency to be long-winded, and that's no surprise. Clearly that's evident, but now I'm going to turn it over to Stacy. Stacy, I've done all the talking, but I'll pass the baton to you.
So I think you had asked a few questions of us. So Macedon does have a telehealth booth. We do have people using it, but not for the purpose that I wanted the booth for, which is telehealth. It tends to be used more for tech training than anything else, which is fine, but it's not, what we wanted to do. We've tried various ways to market it. We attend the CCAC meetings, and we're always open to doing anything that we think could help to promote the booth. But so far, it really, to be honest, it hasn't caught on. We also have like a Tyto. I don't know if you know what that is, but it's a little device you can use to have an appointment. That hasn't caught on. I thought I'd give it a shot just to see, or to see if people would use the booth in conjunction with the Tyto. Like, I'm open to, but neither thing has taken off. And I think, to Jason's point about in his story about the oncologist that kind of made the face when he asked about, what do you think about telehealth? I kind of think that there needs to be an education of providers that, okay, maybe in their purview, a visit that's through telehealth isn't of the same quality as a one-on-one in-person visit. However, if you take that idea and you say, isn't a visit of some sort better than a visit of no sort? So that's I feel like the talking point we need to have with our medical providers, because they need to see that light. Like, if you don't participate in this, you really are probably cutting off a decent segment of the population that is just not going to get any care at all. So that's all I'd like to say, because that just really filled my whole brain as Jason was talking. And I feel like how can we get that message out to providers? Who can we work with? I don't know that a doctor wants to be told by a librarian, like what to think or how to think, but maybe we could partner with people Jason probably knows that could have these conversations and maybe help to have the providers see the light a little bit more.
And that, Kelly, or that, Stacy, is actually an excellent point, because our work group is part of the CCAC and part of the Wilmot URMC project, we have availability to speak with, at the very minimum, at least the URMC providers,
Right.
to have that conversation. That's a captive audience. They work for this organization. So when we have folks like the Charles Keenans that and the Dr. Jonathan Freebergs, which are the directors of the Wilmot Cancer Institute, reach out to them and say, we need you involved in this project. We need your feedback. We need you to interact with our work groups. That's how we get stuff going. And maybe it's a matter of grabbing a provider that is a URMC provider within your catchment area and bringing them in for a telehealth open house at your library. I mean, that would be stellar, right? So let's do a mock visit. We've got a provider here that and a patient navigator to come to the library. One will play patient, one will I know URMC, as Stacy and I have found out, has a video that shows an interaction with a provider on using telehealth. Maybe we run that, and maybe we have a provider there to answer questions with your library patrons that says, well, I've got a question. What if, I've got a mole that is concerning to me, and doesn't that require me to drive to try to get an appointment with a dermatologist, which, as you know, will take 7 months to get in to a dermatologist. I don't know if any of you ever seen a dermatologist, but I have. It literally takes forever. My wife just had her dermatology appointment 2 days ago, and she brings up a mole with the provider. And you know what the provider said? Said, oh, you should have called to get in. And Jen was like, I'm here. I called 3 months ago to get in. Now I'm here. Like, that's when they could get me in 3 months later. So, the provider can say, that's a perfect opportunity where we can utilize technology for me to do an initial scan by looking at your mole to see if it's suspicious. And if it is, guess what? I'm going to directly refer you to another URMC dermatologist that can get you in. So when providers call other providers and make a referral, it's different than a patient calling on the phone and saying, hi, Stacy, I'm Jason Coleman, and I have a mole that looks kind of silly. Can you check it out? We'll get you in 3 months, versus a primary care provider or another clinician that calls and says, I've already visually inspected that in a telehealth visit last week, and it's suspicious. What do you have available? Oh, we've got an appointment in 2 weeks. Let's get her in. That's the difference, and that's the potential of this type of stuff. So,
yes,
again,
kind of like another tool for triage that can really get people in more quickly than they would normally.
Totally.
And another area I just wanted to bring up that I feel like maybe we need to figure out a way to have a conversation with lawyers that represent URMC. It's the whole HIPAA compliance piece, because I know that came up in the last meeting, and I feel like a lot more needs to be discussed, and I feel like it should be a discussion that's had with lawyers who have that expertise in HIPAA. I'm not so sure that some of the perceptions that are had about HIPAA and how it works in a telehealth booth such situation are accurate. And if they are accurate, well, then we need to have the conversation about, well, how can it work in a way that's legal and
Yeah, and those are, there are certain guardrails within the healthcare system that we need to comply with. And I think that's part of this work group, is how can we convey that to patients, that they understand that these are HIPAA compliant booths, right? And then, to providers as well. I attend meetings quarterly with a wellness committee at Wayne Central School, where my son goes, and we had our meeting yesterday. And one of the topics of discussion was flu clinic
Mm.
that was run for all the teachers. And one of the teachers that was present raised her hand and said, I don't know if we're HIPAA compliant with these things, because I was on the other side of a curtain listening to all of these medical details that a patient or another teacher was having with the RN that was administering her flu vaccine. Like, is that kosher? Is that legit? And if you were to follow the letter of the HIPAA compliance, that's by no means legit.
I
Period.
don't think I agree. I don't think that could possibly be true, and I'll tell you why. Not long ago, I had to go to Clifton Springs emergency room, and I was put in a emergency room with another person and a curtain,
Yeah.
and they heard everything about me and I heard everything about them. So my understanding of HIPAA is it's about medical records. It's not about verbiage. Another situation that happened recently, I had to go to urgent care, and usually they triage you, like the waiting room is there and there's a window and you're in the middle of everything and everybody's hearing why you're there.
Yep.
So I think that's what I mean when I say I'm not so sure the perceptions people have of HIPAA are actually true. I think HIPAA is about record keeping, not the verbal conversations that people have. Now, that being said, I think as librarians, we want to hold ourselves to a higher standard no matter what HIPAA would say. We want to make sure that when people are having conversations, like that we keep their privacy intact. But to sort of stymie telehealth because of HIPAA, I mean, it's one thing if it is actually true that we can't because of HIPAA regulation, but I'm not so sure that's true. And I think, I think having a conversation with a lawyer or maybe a few lawyers would be definitely beneficial, because I just think there's a lot of mis and disinformation about HIPAA out there.
Yeah, I agree completely. It's there's a wide variability between interpretation of what it is versus a legal definition of what it is. I mean, you pull up to Walgreens, right? You go to the window at the drive-through, and the guy goes, "Your name? Here's my name and my birth date." It like through a speaker while all these patients are standing there. "Oh, what medication are you refilling?" "Oh, I'm here for my Viagra." "Oh, cool." And then all your neighbors are standing at the counter, right?
Knowing that.
Right. It's so there is like a lot of variability versus what the letter of the law says. But I think conveying to patients that this is an acceptable way to interact with your provider, and it's HIPAA compliant, and we have a private room available. It's not just a cubicle. Or something like that, and for providers to know that will increase their comfortability with promoting it, right? So
the biggest thing to consider is staff. So if you get into telehealth, making sure that the reasons people use the booth are not disclosed, because there is a verbal component when it comes to, like, if you have telehealth in a library and one of your staff members knows that this person just went in there because they wanted to consult with a doctor about the possibility of getting Viagra, we'll say.
Right.
And they knew that. And maybe they're just this kind of person that decides to tell a bunch of other people that live on this person's street, "Hey, Joe was in, and guess what?" That is an element. So you can't discuss people's business with other people.
Yeah.
So it's staff specific, but it's complicated. That's why let's bring lawyers in so we can talk about it and figure out how to make it work.
Yeah. And just since this is recorded, let the record reflect that Jason Coleman is not on Viagra. He just used that as an example. So anyhow.
I didn't think you were.
I'll pass it over to Kathy next.
So I'm at the Lyle branch, right in Rochester. We call it our digital equity booth. We get it for a lot of people that are studying, learning things, but we don't get it for a lot of telehealth, partly because we have a lot of lower income families that I think don't get insurance, don't have the ability to, get what they need. So I'm really excited. We had talked about the mental health aspect of it too. And There's like the word has just dropped out of my mind, but there's an idea, a perception that mental health, you don't need that. Mental health is a faux pas, and you shouldn't, you shouldn't get health from it. So I think having that space for, and showing that it is an okay space for people to get this. I'm very excited about it. I liked, was it Stacy that was mentioning in the last meeting about zines and having,
Yes, I think we
yes,
did. That would
having
be,
like a graphic representation of it so that it's, it sort of makes it less scary, the idea
Yeah.
that, this is something that we need.
full disclosure, we did not end up doing the grant that we were talking about that would have, however, it's still on my radar. And if there are people that are interested in pursuing a grant opportunity to try to have marketing that would involve zines or other, what's the word? Like just methods that would be less scary for people to interact with. Like you could contact me after this meeting because I'm open to working with anybody and I like grant writing. So, if anybody wants to do that after. I don't want to hog this meeting with that.
Yeah, I think that there's some willingness on the part of URMC and the Access to Care Committee to support any resources that we come up with that we might be interested in acquiring. So be it, I know it's come up in conversation, the scrolls that roll up, for a real visual impact for the library patrons that go in that say, oh, have you considered telehealth to interact with your provider? And then maybe list out those providers. Could be primary care, could be mental health conversations, and how you choose the verbiage with those types of messaging campaigns really have a tremendous impact on how they're received on the other end. I'm not an expert in that, but I'm always willing to learn. But there is some research on how we choose our words. One example being the work that we're doing around tobacco cessation. Well, we no longer we no longer use the term smoker. Now we use the term tobacco user to reduce the stigma associated with smoking, right? I think there's some room for improvement with how we interact with patients that are interested in taking advantage of mental health services, to soften that verbiage and decrease the resist or reluctance to give it a try. During COVID, pretty much every single employee assistance program for every organization that I'm aware of got overwhelmed with requests for services for mental health. People wanted to interact and nobody could get in to see a mental health provider. So they all were telehealth. They're all telehealth and telehealth only. So it's not that mental health providers are not skilled at using telehealth now. They were forced to be skilled through COVID. So it's just a matter of, working with patients to get them more comfortable with doing that, taking that first step to interact with them. And, mental health is a real important issue.
Yeah, and I think too, again, destigmatize for any provider that might, I know a lot did use it during the pandemic, but some still didn't. But also, in talking to patrons, there is this perception, much like your oncologist had, like, oh, well, it won't be very good if I do it that way. I need to be in person. So like combating that idea that somehow it's better to do nothing than to have this appointment through telehealth. And I don't know because I haven't looked into the research, but is there a difference? Are the results any better if you're in person versus through telehealth when you're talking about mental health? And and even if one is a little better than the other, are the results still both significant enough that, you shouldn't let it be a contradiction just because you have to seek it through telehealth rather than in person.
Yeah, and my hope is that communication this morning from Lene Wyckoff that you were included on that email, that gave the overview of the URMC grant project around telehealth may have some of that data in there. I haven't had a chance to read it yet because it just came over this morning, but
Yeah, I
my
haven't
hope
read
is that maybe there's some nuggets in there of data that would tell us that. So
Yeah,
we'll see.
that might be worth doing before the next forum meeting.
Yeah,
About some
definitely.
time to just look at the research and see if there is any out there.
Mm-hmm. Yeah. How about Kim?
I'm Kim Arachi. I'm from the Williamson Public Library. We're located in a rural area, and we
315.
yeah, we ended up with the same grant as Stacy and Kathy had with the RLC for the telehealth and digital equity booth. And we expected the same, I think, as Stacy did, that we would have a lot more use of it because being in a rural area, it's very hard for people to commute to the city for a doctor's appointment. They may not have transportation, or they have limited PTO, and it involves taking off a considerable amount of time from work. But we haven't seen the use at the levels that we expected. And I think we've tried getting the word out and marketing it, but it could be used a lot more. And from the telehealth perspective, I think it's an excellent idea. I know from my own family members, they did telehealth during the pandemic, and it's continued for their mental health support. And they have actually felt it's a very positive environment because it's more private. They are not sitting in a waiting room where they run into somebody they know, or they don't have to leave an area to go do it. The only thing they've said is they don't want to do it during school time because they don't feel comfortable in a school environment that is private enough.
Right
But
on.
having it off site that they could go to would be great. And for my one family member that doesn't drive and didn't have a driver's license, that was the easiest way for them to connect for mental health services during their time at university, was to do it through telehealth. So I think, and they felt it was the same quality of the appointment that they had in person, and was just a lot easier and took up a lot less time in their school schedules and that. So I think there's a lot of potential, and I agree with Stacy. It's trying to get that comfort level from physicians to do that. And going through oncology myself this summer, there was a lot of visits. I thought, wow, if I could have just done this through telehealth, I wouldn't have had to make the commute. It was a very simple follow-up visit. It didn't involve, it was mainly just discussion, and I wouldn't have had to take off the day from work and pay for parking
Sure.
and all this. It would have been a lot easier. So I think that there's definitely potential. It's just kind of getting everybody on board and making them comfortable with how it could be done and that.
I'm picking up what you're laying down, Kim Arachi.
Yeah.
Thank you for sharing. Kelly, how about you?
Hi, everyone. I'm Kelly Pavro. I'm from the Watkins Glen Library in Schuyler County. So Jason and I have met several times. He's a frequent visitor of the Watkins Library, which is great. We don't have a booth. We have a telehealth kit that was provided through the grant. And there's 5 total in the Southern Tier Library System. 38 checkouts total. I pulled some stats this morning, and that's between all 5. Ours has been out 4 times. Half positive feedback, and we did have one patron that borrowed it that had connectivity issues. And again, if you're not familiar with Schuyler County, it is very rural. And unfortunately, we just still don't have internet in all aspects of our county. So that's unfortunate. But the nice thing about it is that now we're able to kind of track that a little bit and say, okay, so we know, internet in Beaver Dams may not be this great, or internet here is where people are struggling. I love this idea. I'd written it down before, Jason, you had said a telehealth open house, and I wrote down like a how-to telehealth meeting. So we've done a lot of marketing for it. I definitely learned early on social media marketing is not the way to go for this. Those are not the people that are going to be using your telehealth kits. We tried putting some ads in papers, still similar to what Stacy said and what everyone else is experiencing. I think we're all kind of seeing the same thing. It's underutilized, and we're struggling. How do we figure out how to make this something that the community sees as an asset, and that we can reach those people who aren't coming into the library and aren't in their doctor's offices. And I think that's one thing we haven't tried yet, is putting together some in-person programs that are like what is telehealth here, maybe from people other than myself, more skilled, who can explain, these are some of the things that you can do. Here's how, the UR app works. I think those are great opportunities, and definitely part of the gap that we're missing here. We recently purchased a meeting owl. I don't know if anybody's used a meeting owl yet. It's a pretty advanced technology, piece of technology. It is a 360-degree camera. And it's also, so basically you can do hybrid or large meetings. So it captures like the video of an entire room. It's sound activated and motion activated. So it'll automatically move to whoever is speaking. Yeah, I've used it for some. Yeah, so we actually are making it available for organizations that want to borrow it in the county. So I had met with, we have a public health, the Skylar Heal, had some people who were talking about doing, mindfulness and meditation things through a meeting owl, sort of like so anyway, the long short of that is that I was thinking I could do even offer virtual programs about how to telehealth using the meeting owl, because I can provide it for a larger group. So those are just some thoughts, and yeah, a little bit of feedback about our experiences, but we're definitely interested in trying to really push this. I think everybody who's spoken has made some really important points today.
Yeah, and I agree with Kelly, and I had said from the get-go, if there was a way to have a sandbox for My Care or My Chart or any of these kind of apps, because I know not everybody uses the same exact one depending on where you're located, but that would be so helpful to librarians, because then we would be able to play with it and put together a presentation, and maybe you could do it in person, but also if you have an owl, you could record it, and lots of people could zoom in and also view the recording afterwards, and it would be wonderful.
And Kelly, you've got the availability of that private conference room for a HIPAA compliant, great Wi-Fi interaction, to do maybe some kind of open house that, we use the grant funds to pay for refreshments and make some food available and have a local provider and, make a big thing of it, that say, come on in, let's take a walk around together. Let me show you what we got available for you as a library patron. This is an asset to our community, and it's available for you whenever you need it. Like we have a process in place. Here's the process, and we get a workflow to reserve this space for you. And then you have an interaction with your provider at your convenience. It's convenient for the provider, and it's convenient for you, but most importantly, it connects you to healthcare because we care about your health. That's a great conversation to have, right? So awesome stuff. Thanks, Kelly. And Julia.
Hey there. Yes. So I'm Julia Lampson. I'm at the Friendship Free Library within the Southern Tier Library System. And we're also pretty rural. Friendship has a population of 1,100 people. And we do have a telehealth machine here at Friendship. I'm new to the area. I just started here the beginning of June of this year. We've had the telehealth machine, my understanding is, for a little while. And we do not have people use it. We have a private conference room space downstairs where everything is available. But I'll be very honest, when I got here in June, I think marketing is a big issue for us. And we have services available, we have resources, and people don't know it. They think of us as an old stuffy library because our building is from 1912. It's a matter of getting people to use it, because there is certainly a need in our community. So I did a community engagement survey relatively soon after I got here, and 90% of the town gets their information from Facebook. So, you know, I've been trying to use that as a marketing tool. And honestly, our attendance for programs has gone way up. It's been great. And I think it's because we're getting the word out there. So
Awesome.
I started a Saturday Facebook post series where I just highlight a resource that the library has and let people know. I personally started following a couple of community pages on Facebook, and people just say, you know, asking questions about like garbage day and like, hey, there's a dog loose, that kind of thing. And people they're like, well, where can I fax something? And they're like, well, you can go 2 towns over, and I'm like, well, come to the library. So I think people don't know we have the services. And so telehealth is my next Saturday post, and I'm hoping to kind of do a push on it. I love the idea of having a provider come and doing an open house. I'm hoping that's something that I can work on with a local provider. The closest UR hospital to us is Jones Memorial in Wellsville. So I'm hoping maybe I can connect with some providers over there. If anybody has any other resources, that would be great. But, you know, telehealth is such a wonderful resource anyway. You know, my therapist is still in Washington State. And I was able to keep working with her because, you know, we do everything online, and it's been a wonderful resource for me. So I really would love to expand that for my community. So, and this has been a wonderful resource as well. I'm really happy this is happening.
Excellent. Well, what a wonderful story, and thanks for sharing, Julia. And we're glad you're part of this group. It sounds like you're ahead of the game with your access to the community through your social media, and I think that's fantastic. I mean, have you know, create a Facebook invite and have for an open house with an RSVP. If 90% of your target population are using that for a vehicle, you could even get an idea how many people are planning on showing up. You know, I mean, that's
absolutely.
That's awesome. That is really awesome.
And
we're going to learn.
I would love if people would register through Facebook, because I tell you, this is not a town of people that like to register for things. So maybe if I can get them to do it through Facebook. But I'll mention one other thing, is I recently, I have a wonderful board of trustees that, you know, are very involved within the community and have a lot of, you know, resources and access to things. And a friend of a friend heard about the library through one of my trustee members. There's a local radio station that is willing to do advertising for us for free because we're a library. So this is one of those things that I think, you know, we come up with a quick little blurb and we put it on the radio, and we might reach people that aren't on Facebook, you know, that don't use that social media aspect, because you know, there is a segment of the population, even if it's 10% in Friendship, that, you know, is just not going to get the news. So I think any way I can do some marketing to get the word out there, I'm excited about.
Yeah. And Julia, that's where we can pull in again, you know, Wilmot and URMC to say, you know, where's a URMC provider close to your location that we can make available or ask to be available for an open house, or have them come in for a radio segment, right?
I think that'd be wonderful.
Yeah, have them interviewed as to, you know, here's the potential that I see with my patients using telehealth. And we see that, you know, our partnership with the Friendship Library to be integral to building that relationship with a population that needs healthcare. I encourage you to talk to your provider about utilizing telehealth and your local Friendship Library. I mean, I think I just wrote the segment right there. Like,
I know I've got to write faster. I'm writing all this down.
But that's where we are very lucky and very fortunate to be, you know, a small project as part of a big organization, because we can pull them in to help us pull those levers with URMC providers to say, we, you know, this organizationally, we see the potential of this, but it can't be successful without your help as a provider. Come help us with this project. So great stuff, Julia. Thank you. So what else? We've got 6 minutes. This was a great meeting. I thought it would be just a quick one with only 5 of us, but it was amazing. And I want to thank you all for being candid and sharing, you know, creating a safe space for us to be a think tank together, and trusting each other and being willing to share in what we know, and sharing what's worked, what hasn't worked is the strength of this group. And I will constantly be reminding us to try to continue to bring more folks under our tent as part of this project. Other librarians that you work with in your day-to-day interactions, to share in this project, to encourage them to be part of our group, because the more the merrier is my opinion. And I'm sure Stacy and the rest of you would probably agree that the diversity and input and diversity of experience and willingness to share is really what represents so much potential for this. So again, my thanks from the bottom of my heart for your willingness to be part of this project, to help your communities be healthier. Thank you so much. And I think, and I think, Stacy, should we schedule a meeting for next week to try to get the rest of the group on board, or do we want to wait until our next scheduled in 4 weeks?
Open to either, I guess.
So I will say, so next week is the New York Library Association conference. I don't know about Julia, but I will definitely be, I will be in Saratoga pretty much most of the week. So
nice. You gonna bet on the ponies while you're down there, or what?
No.
and Thursday at this time, Thursday's Halloween, so it probably wouldn't get a lot of folks anyway. So maybe we can try 2 weeks from now.
I definitely would love to do another one of these meetings, maybe make it like every other month or something, like a regularly, if we can find a good time that would work for people, or even if we had to change it, the time and day of the week to accommodate. I think it would be nice to just, keep it up. And like you said, it's good. I'm a big fan of knowledge management, best practices. So what works, what doesn't.
Yeah. Well, Stacy, did you send out a meeting series or just the invite for this one? Because our plan is to meet monthly.
Right. And I think it was just one for this one.
Okay. So we'll probably follow up with a recurring meeting invite for this time and day each month for the remainder of the year. And then we will reconvene in December and say, does everyone agree that we should continue to meet monthly, or would you prefer to go less frequently? So we can continue to paint this blank canvas as we want it to look as this project develops. So sound good?
Yeah.
Excellent.
Before we go, I just want to say, if anybody out there wants to talk about the idea of brainstorming for a grant to have zines and other marketing opportunities, my email address is, you should be able to see it on my box, macedonlibrarydirector@owl.org. Just reach out, or I'll give you my work phone number, 315-986-5932. Happy to talk if anybody has a great idea or wants to come up with a great idea. I think marketing would really, really help.
Yeah. And I'll give you a good trick for Zoom. If you go into your meeting invitation and click on tracking, it will list all of the people in the invitation with their email contact address. So you can pull that down if you want to reach out to anyone within the group specifically offline to have to continue a conversation. So there you go. Everyone have a great day. And again, this is wonderful. And thanks for spending an hour with us this morning.
Thank you.
Thank you.
You bet.
Bye.
See you soon.
Bye.
Bye-bye.